Oh, good morning. Dr. Patino here at the Cosmetic Surgical Center of Torito. So what do you see there?
We see beautiful yellow fat.
And what are we doing today?
Liposuction, my favorite.
Thank you. Wow, so look at that. This is micro power assisted liposuction by Dr. Gabriel Patino. What do you see coming out there, Emily?
I see yellow fat in that tube.
And you know, that's what's gonna go into her buttocks. So we're doing micro power assisted liposuction to pretty much many areas in her body, but we're probably gonna stage it. So we could do part of it today, most of it, and then part of it tomorrow. Because we don't want to exposure to a very prolonged surgery time in anesthesia, because when you prolong the anesthesia time, there's more risk and complications. So this is this beautiful oilless and bloodless fat graft. And that's what's going to go into our buttocks. We don't need to use any commercially available processing systems to clean the fat. Why? Because the fat is clean. It doesn't need to be clean. Right? It doesn't get any better than this. So
yes.
Instead of cleaning the fat with commercially available products, which is what most surgeons do, they get this fat graft and it's red and with a lot of oil, and then they process it, but it still looks red and pink when they put it in, meaning that you're going to put blood and oil into the buttocks, and we don't do that, right? Because we don't need to. Look at that. Beautiful. Thank you. Alrighty, so we're doing micro power assisted liposuction, high definition to the abdomen now. Wow, so she's on her side. We're working on her waist now. So we're doing the lower back and the flanks and hips, and then we'll do a fat transfer to the buttocks. She looks incredible. Then transfer this beautiful yellow fat in there. Thank you. So Wendy, what's going on?
Oh my gosh, are we still getting that beautiful yellow fat?
Wow.
And we're almost at the end.
Yeah, and so this is what's gonna go into her buttocks, really, you know. So she's on her side, and we're doing the flanks, hips, and the lower. So we're done. This is the other side. Remember how it was? It was like that. Actually, you didn't see it, but look, look at the pinch test. So I'm gonna do it this way. You see? So this is the belly here, and this is the waist here, the buttocks are over here, and this is the back. But look at the waist, see? 0.5 centimeters of the pinch test. It's just like absolutely no excess fat anywhere you go, okay? And if I do it this way, you can also see it, look, see? So you can go, I don't know which one is easier for you, that you can see, you see? But what it means is down to 0.5 centimeters on the pinch test, the beautiful waist. And we're gonna do a fat transfer to the buttocks now. She's on her side, buttocks here. This is the back area, flanks, hips, lower back, and waist. Thank you. Alrighty, so this is the ultrasound guided gluteal fat transfer. Like I promised you, this fat graft has not been treated with any commercially available cleaning systems. It doesn't need to be clean because it is clean. It is bloodless, oilless fat graft. And I'm looking at what's going in, which is pure. Looking at the patient. According to the World Association of Cardiac Surgeons, we're going to put this in the deep subcutaneous space where God put it. That's where it belongs, and it's safe. Thank you. Alrighty, so you can see that muscle is that thick layer there, and you see the cannula right there. I'm wiggling the tip of the cannula. You can see it. Below that, in this area, is the deep gluteal fascia. Above in this area is the superficial gluteal fascia, and right here, look at the tip of the cannula. I'm gonna aim it better. See that? The tip of the cannula right there. You're gonna see at the tip right there, I'm gonna wiggle it for you, a cloud of gray, and you're gonna see how everything's gonna get bigger in this deep subcutaneous space, which is actually very, very small. That illustrates how the muscle is that huge thin under that bright light. That's a striated muscle. That's where we don't want to go. And look at what's going to happen. The muscle is going to push down. That's the subcutaneous space. See how it's being pushed down? That's the muscle being pushed down. And the cannula is in the deep subcutaneous space. Again, see, I'm wiggling it and you can see it. You see that cloud of gray is the fat going into the, and now the space is bigger. You see how tiny that was? But if you do those blindly without ultrasound, then you can certainly go into the muscle and it could be a disaster. See my cannula, right cannula right there? Again, I'm going to give it another bubble and see how things move down, you see? That's how we do it. Thank you. Wow, so this is high definition of the back. Look at the nice paravertebral muscles here and the midline, and the buttocks are on this side. We're done. She looks incredible, very athletic. High definition on the back side also, with the most beautiful buttocks projecting nicely round and with excellent aesthetics. Thank you.